Hi. The triangle of insight isn't a new idea. It's been around since 1958. But a fairly small subset of therapists know about it and use it in their work to help patients. In this video, you'll learn about the historical and conceptual roots of the triangle of insight and how it can take psychotherapy to a deeper level to get at the root of your problems. I'm Dr. Stephen Reidbord, and I'm a psychiatrist in San Francisco with a mostly psychotherapy practice. I published psychotherapy research early in my career, and I've taught psychiatrists in training about psychotherapy for decades. And this is More Than Meds, where I talk about psychotherapy and psychologically informed psychiatry. The original triangle of insight was proposed by psychiatrist Karl Menninger in 1958. Dr. Menninger was born in Topeka, Kansas in 1893, and after going to Harvard Medical School and working in a Boston psychiatric hospital for a few years, he returned to his hometown of Topeka and opened the Menninger Clinic in 1919. A few years later, he opened a psychiatric hospital there too, called the Menninger Sanitarium. Menninger and his clinic became quite well known, and when World War II broke out in the 1940s, he was sent to Europe to study and offer advice about the psychiatric needs of military personnel. After the war, he founded a veterans hospital devoted to the psychiatric needs of returning veterans. And he was pretty central in the development of treatments for what was, at the time, called battle fatigue, and we now call PTSD, or post-traumatic stress disorder. Menninger was trained at a time when the main form of psychiatric treatment was psychoanalysis, an intensive type of psychotherapy occurs multiple times per week. The patient lies down on a couch and the analyst instructs them to say whatever comes to mind without censoring themselves or holding anything back. The analyst periodically comments on how the patient's thoughts and feelings are flowing during the hour. In addition to asking some questions to clarify things or to ask for more details, the analyst offers well-timed interpretations. That's a technical term. These are intended, in Freud's words, to make the unconscious conscious. An interpretation is a kind of educated guess about what is keeping the patient stuck, or it links apparently unrelated feelings that the patient has talked about, pulls them together underneath. In general, it proposes something that the patient wasn't aware of about themselves, that was unconscious. According to traditional psychoanalytic theory, with this new insight, the patient no longer needs to employ defense mechanisms and expend energy to keep that material out of consciousness, to keep themselves unaware of feelings or wishes that are usually unpleasant and that they would rather not have, ones they've been avoiding. It's emotionally freeing. Psychoanalysis famously focuses on a patient's early childhood because that's where emotional conflicts originate and begin to help form and mold our growing personalities. So an interpretation could refer to early childhood experiences and feelings that the patient had been talking about in the session, or it could refer to present-day feelings and circumstances that the patient had also been talking about in the treatment, things that affect their functioning in their current life. Then there's the third area, the transference. And these are the thoughts and feelings and attitudes that the patient has towards the analyst or therapist, him or herself. Psychoanalysis makes a lot of use of this idea of transference because it provides a kind of window to see how the patient feels and what their assumptions are about somebody that they don't know very well. It's the main reason analysts don't disclose very much about themselves, don't answer personal questions, because in not doing that, they leave the field open for the patient to imagine and to offer their assumptions and prejudices about the therapist or analyst, and that discloses a lot about how they see themselves and others in relation. So psychoanalysts and therapists who provide a similar but less intensive form of psychotherapy that we call psychodynamic psychotherapy, and that's what I offer, can suggest interpretations in three different areas: in the patient's current life, in their early childhood that they've spoken about, and also in the transference itself. And here's where the triangle of insight comes in. Menninger proposed that an interpretation that linked all three of those areas was especially effective. The reasoning was that an interpretation that included the patient's current life experience was practical. It applied to the very thing that brought the patient in for treatment. It had relevance to their current life, whereas a reference to the transference really brings it alive because it's about what's happening in the room in real time. Also, it's not intellectual. There are feelings that are happening really just as they're talking about it. Can't be avoided or ignored. And then a reference to early childhood puts it all in the context of the patient's life history and kind of provides a sort of explanation of how the person came to be who they are today. Here's an example. A psychoanalyst or a psychodynamic therapist like me, after listening to a patient for a fairly long time, might say something like this: "We've been talking about your strong need to please your boss at work. You try so hard that it really burdens you, and actually it backfires. It makes your boss uncomfortable and avoid you. And this reminds me of what you were saying about how you tried so hard to please your father when you were young. And yet it didn't work. It kind of backfired there too. He didn't even seem to like it." And then something like that happens with us too, doesn't it? You agree with everything I say right away, and yet I find myself frustrated that in your rush to agree, you don't let it sink in and really pay attention to what I've said. You try to please me, but once again, it doesn't really work. In all of these cases, I wonder whether your urge to please covers less positive feelings, like resentment at having to submit to an authority. Now, as you can tell, the triangle of insight only occurs in therapies that aim towards insight, towards helping the person realize things about themselves that they weren't already aware of. A lot of therapy these days doesn't even attempt that. It really focuses exclusively on what the patient or client brings in, what they're already conscious of, what they already know about themselves. Now, mental health would be a lot simpler and more straightforward if people didn't have complex, mixed feelings about things. If they didn't try to hide aspects of themselves, some of their own feelings and wishes from themselves, if they were an open book. But honestly, nobody's that simple. So you have a choice. You can ignore that complexity and go to therapy that's laser focused on a specific symptom or two, like depression or anxiety, not really get at the complexity underneath. Or you can embrace that complexity and deal with it. It's up to you. And I talk about that in this video over here. Just as psychoanalysis and related psychodynamic therapies have continued to adapt and evolve over the years, the triangle of insight has too. It was originally based, as I said, in Freudian theory, which focuses on defense mechanisms and how they hold unacceptable wishes and fears and thoughts out of awareness. But other flavors of psychoanalysis and psychodynamic therapy use it too. For example, the school called object relations theory focuses instead on the mental models or schema that we have in our heads about ourselves and others. For example, I may see myself as a needy person and the people around me as suppliers of things that I need. Or I may see myself as a hurt, weak child and the people around me as comforting adults who will take care of me. Or maybe I'm the comforting adult, the rescuer, and I see a world of people around me who are hurt and in need of my help. Or maybe I'm a smart guy and others are suckers for me to exploit. The possibilities are endless, but here too, those models can apply to the patient's current life, to their early childhood experience, and also to the transference. So the triangle of insight can be applied here too. In recent years, the triangle of insight has been used as a tool to teach trainees, as a way to formulate cases, that is, to describe narratively or in writing the way a person's psychology works, how their emotional world looks. And it's also been applied in variations on psychoanalytic and psychodynamic therapies that are time-limited or short-term. It provides a structured yet flexible framework for understanding a patient or yourself, and highlights how we're a product of our own personal history and how we bring that history and our personalities to every encounter we have with other people. Well, that's it for this time. Let me know what you think about the triangle of insight in the comments. Please like this video, but only if you really like it. Please subscribe if you have not already. And if you have a few more minutes, here's another video about psychotherapy and psychologically informed psychiatry. I'll see you next time.